Good evening to everyone and welcome to today's session. Jitendra Verma, Shipra Shukla, Pavandeep Singh, Maruf Khan, and many more who are all online. Today is our last day of obstetrics and gynecology. Just like Indian Railways, we are going about 1 week slow in our schedule. So for the past 1 month, we had been preparing seriously, and we finished almost 700 MCQs, topic-wise classified, from the past 15 years of All India and NEET PG exam. And after that, we started AIMS question bank. Actually, we are supposed to start surgery. So there are about 400 questions in AIMS question bank from the subject of obstetrics and gynecology for the past 15 years. And we had been laboring, though it is a little delayed labor, but it is not an obstructed labor. By now, you're all very sure, very confident about obstetrics and gynecology. Are you ready to crack the last 100 questions in obstetrics and gynecology so that we can say ta-ta, goodbye, and start surgery from tomorrow onwards? So, doctor, let's go to continuation of our discussion, obstetrics and gynecology. Please drop a line with all your classmates on the various social media groups that the daily free live class with Dr. Murali Bharadwaj has started. Now, the most common cause of female pseudohermaphroditism, typically a newborn girl, there's a salt wasting, difficulty to thrive. She's also showing clitoromegaly. So that is the typical picture of 21 alpha hydroxylase deficiency with excess amount of androgen and mineralocorticoid deficiency, which is typically presenting as female pseudohermaphroditism. The most common cause is congenital adrenal hyperplasia and even adrenocortical tumor. But if you take the two, adrenocortical tumor becomes a much more common cause compared to that of the CH in terms of incidence of percentage. That's all. Now, antenatally, if there is a congenital adrenal hyperplasia suspected and you made a diagnosis, good to see Ankur Sharma, Bembem, and many more. So what is the treatment of choice? Treatment of choice in prenatal congenital adrenal hyperplasia, dexamethasone. All of you know very well, the moment the suprarenal gland adrenal is not producing the steroid, there is a strong stimulus for the pituitary to produce ACTH, and that ACTH is causing excessive hypertrophy, which is responsible for congenital adrenal hyperplasia. How can you treat it? How can you cure it? By giving steroid is what you need to remember. Then the online students can punch where the voice is loud and clear for all of you. Now, which type of abnormality in sexual development it has the best prognosis? Any day it is congenital adrenal hyperplasia, because congenital hyperplasia, adrenal hyperplasia, very good. Typically, if you happen to give dexamethasone, if you happen to give steroid, you can stop that stimulus to produce excess ACTH and the patient's problem is solved. That's the reason it has the best prognosis is what you need to remember. Keep punching the answers, doctor. Today onwards, I'm going to give you some sweet surprise. Okay? So, it is called Spardhaya Vardhate Vidya. Competition expands the knowledge. Spardhaya Vardhate Vidya. We strongly believe in that. So from today onwards, I'm going to give you 10 multiple choice question quiz. You need to download, you need to type kahoot.in. Kahoot, Kahoot, Kahoot is a website. And there you will be presented a MCQ. You have 30 seconds of time available for you to answer it on it. And 10 questions are there, like Kaun Banega Karorpati. 10 out of 10 if you do right. To all the people who did right, 10 by 10, you will get a free coaching of online MBBS subscription worth of 40,000 rupees. You will get it. And if you answer 9 out of 10 correctly, you get 90% discount. And if you answer 8 out of 10, you get 80% discount. So be ready. Tell your friends also to join the Kahoot quiz that we conduct every day. If all of you get 10 by 10, I will give all of you a free subscription coupon of the 40,000 worth onlineMBBS.com video library, which has 3,000 video lectures, PowerPoints, quizzes, 30,000 MCQ, Q scanner. Everything is made free for all of you who crack it 10 by 10. Spardhaya Vardhate Vidya. Let us see. But first, let us finish the discussion of the leftover 100 MCQs and also inform your friends to join for this mukabala that we will have every day to inspire you basically to prepare for the exam, right? So, yes, doctor. Wonderful. Now, candidiasis. A lady presented with a creamy white vaginal discharge, fishy odor. What is your answer? The one and only answer would be to give her metronidazole. So what are all the risk factors for vaginal candidiasis? Diabetes, HIV, pregnancy, any immunocompromised state, they're all considered to be the risk factors for vaginal candidiasis. Ankar Sharma gives a good compliment. You are my idol, sir. Definitely. Right? Murali Bharadwaj means Murali idol. So, no worries. I always want to listen a good news from you that you got inspired, you studied, you did better in the exam, you got the dream branch of your choice. My ears are all yearning every moment to listen that good news from you. In the process, if I can be a small instrument and a means to inspire you, that is the grace of the God. So, doctor, a young lady, copious vaginal discharge, no cervical discharge on speculum. Very important clue. So what do you want to give in management? You need to go both metronidazole and also fluconazole in this given case. Which is most commonly implicated HPV in the genital warts. 6, even though 16, 18, they are implicated in the oncogenesis. 6 is most commonly implicated. In pregnancy, for the genital warts, what is the treatment, doc? You should remember it is the cryotherapy which is considered to be the treatment of genital warts in pregnancy, a relatively non-teratogenic option which is available for you. So what type of vaccine is HPV? HPV is both bivalent and quadrivalent vaccine. The bivalent vaccine contains HPV 16 and 18. Quadrivalent contains 6, 11, 16, 18. And typically it is the aluminum hydroxyphosphate sulfate, which is considered to be the adjuvant in the HPV vaccine, is what you need to remember. Jaundice in pregnancy is the next favorite topic of the examiner. A 9-month-old lady with jaundice, abdominal distension, fetal edema. After delivering normal baby, her clinical condition deteriorates with increasing abdominal distension, severe ascites. Her bilirubin is 5, alkaline phosphatase 450, ALT is 345, there is a tender hepatomegaly, 6 centimeters below the costal margin, and ascitic fluid is showing a protein less than 2. Less than 2 typically is a transudae. That is a very important clue. Number 1, she is pregnant. Number 2, she is having ascites. Number 3, she is having liver dysfunction. All these things combined together, what comes to your mind? What comes to your mind with a tender hepatomegaly? You should think of Budd-Chiari syndrome. So what is the clue to say that this is Budd-Chiari syndrome? SOG value. So you should always remember, this is one of the favorite questions of the examiner. SOG more than 1.1, SOG less than 1.1. SOG less than 1.1, it is an exudate. More than 1.1 is a transudate. So, Budd-Chiari, portal vein thrombosis, alcoholic hepatitis, cardiac ascites, cirrhosis, fulminant hepatic failure, mixed edema, fatty liver of pregnancy, etc., they're all responsible for SOG more than 1.1 milligram per deciliter is what you need to remember. Also, you should remember what is cardiac ascites. In which condition do you get cardiac ascites? Whenever there is any constrictive pericarditis, a tight pericardium around the heart, it won't let the heart to expand easily. That lead to a back pressure from the right side of the heart on the liver, and that lead to development of ascites is the presenting feature. Fulminant hepatic failure, Budd-Chiari, both of them, it is more than 1. How do you differentiate? Other clinical signs. You need to look for other clinical signs. For example, fulminant liver failure, there should be some predisposing factors, like Reis syndrome in case of children. Similarly, hepatitis E infection in the case of the pregnant women. So the fulminant hepatic failure has its own set of clinical presenting features. That is a differentiator. Now, peritoneal carcinomatosis, tuberculous peritonitis, pancreatic ascites, bowel obstruction, biliary ascites, nephrotic syndrome, they're all the causes with SOG less than 1.1 milligram per deciliter is what you need to remember. So, doctor, total protein in ascitic fluid and SOG, if you look at it. Cirrhosis, cardiac ascites, Budd-Chiari. All of them have a SOG more than 1.1. But the total protein in ascitic fluid is less than 2.5 if it is cirrhosis. Whereas more than 2.5 if it is cardiac ascites or Budd-Chiari. This once more answers Dr. Shipra's question. Then SOG less than 1.1, but total protein of the ascitic fluid is less than 2.5. Think of nephrotic syndrome and mixed edema. SOG less than 1.1, but total protein in the ascitic fluid is more than 2.5. Then think of infections, malignancy, and pancreatic ascites. Ankur Sharma rightly says cirrhosis will not allow even small protein to leak out. More than that, cirrhosis is a state of hypoalbuminemia. A cirrhotic liver is incapable of producing the protein. Whether it is a protein leaked into ascitic fluid or protein at all is not produced by the cirrhosis. That's how you can be able to remember. So will you promise me that you will take a snap of this screenshot Lelo or Manmela? So now what are the common causes of the butt cheering? Hypercoagulable states, which are naturally hypercoagulable and acquired hypercoagulable, and tumoral invasion, infections, etc., etc. Now, what is the investigation of choice in cholestasis of pregnancy? Interesting question. So you should remember serum bile acids. Any cholestasis, any obstruction, cholestasis, not only bilirubin increase, but bile salts also increase. That is one key factor, key feature, very unique for obstructive jaundice compared to that of hemolytic jaundice or hepatocellular jaundice. Also, deoxycholic acid is the drug of choice for the treatment of intrahepatic cholestasis of pregnancy. The other day we have discussed in a great detail, if you remember, right? How to differentiate acute fatty liver of pregnancy versus intrahepatic cholestasis of pregnancy versus HELLP syndrome versus hepatitis leading to jaundice in pregnancy. Everything we have discussed in a great detail. Right? If you missed that, please go back to onlinembbs.com video library. Right? And please do a quick revision. Now, at what gestational age should a pregnancy with cholestasis should be terminated? Typically, by 38th week, you can be able to kincho. Mother, 38th week is the maximum upper limit. Chalo, you have to finish the pregnancy if there is cholestasis of pregnancy. Now, doctor, 26-year-old female suffers from PPH. Her ability is prolonged, but the bleeding time, prothrombin time, platelet count, they're all normal. What is your diagnosis? In pregnant women. In pregnant women, one of the options was somebody was saying why not APLA syndrome? You mean to say APLA? Why not APLA? APLA, laboratory-wise, presents with prolonged hepatitis. Remember, very good question asked by Ankur. APLA, antiphospholipid antibody syndrome, laboratory-wise will show prolonged hepatitis. But clinically, it is not a bleeding diathesis. More often, it is a thrombotic tendency. That's what you need to remember about APLA. Okay? So this is the case of acquired hemophilia, is what you need to remember. So it is a severe bleeding diathesis presenting with postpartum hemorrhage sometimes in pregnant women, where they typically present with no family history, no personal history of any abdominal bleeding, only after pregnancy, after delivery, they present with PPH. That's how acquired hemophilia can present. In the treatment of postpartum hemorrhage, we use misoprostol, which is a prostaglandin, carboprost, which is a prostaglandin, and methyl ergotamine, which is a vasoconstrictor, but not mifepristone. Mifepristone is anti-progesterone, is what you need to remember. Shock index can be used to know the severity of the bleeding in the case of the hemorrhage. What is the most indicative thing of a significant PPH? the moment shock index is 0.9 to 1.1, it is indicative of significant postpartum hemorrhage is what you need to remember. So basically you get shock index by dividing heart rate divided by systolic blood pressure is what you need to remember. So doctor, what is the rule of 30 is an important question. 30% blood loss means moderate shock. When moderate shock is there, pulse rate increase more than 30 beats per minute. Respiratory rate is more than 30 per minute. Systolic BP will drop by 30 millimeters mercury. Urine output will be less than 30 ml per hour. Hematocrit drop will be more than 30%. So the shock index is pulse rate divided by systolic BP divided by systolic BP, and this changes by 30%. That's the point you need to appreciate. Normally, shock index is 0.5 to 0.7. The moment it is more than 0.9, so Ankur is asking, sir, is it systolic or mean arterial pressure? It's a systolic BP, drop by 30 millimeters of mercury. And more than 0.9 indicates a severe shock and it requires urgent resuscitation. Now, the next favorite topic of the examiner is presentation. Now, when you have done pervaginal examination, anterior fontanel and supraorbital ridge are felt in the second stage of labor. So what type of presentation you can be able to palpate the supraorbital ridge is the question of the examiner. Typically in bro presentation. So what happens in bro, doctor, bro? So you should remember the bro, who is the fetal head. When does bro occur? Partially extended, with the frontal bone which is bounded by anterior fontanellae and orbital ridges are lying in the pelvic bridge. The presenting diameter is 13.5 centimeters and it is mento-vertical. Mento-vertical in case of bro presentation, and it is bigger than any other diameter in the pelvis. It is extremely rare, only 1 in 1,000 deliveries. So in the bro, what you feel is anterior fontanel up to supraorbital ridge is the thing that you classically feel. So once more, favorite question of the examiner: vertex versus occipitoposterior versus bro versus face. A complete flexion, salam karo, that is vertex. Suboccipitobregmatic is the engaging diameter and 9.5 centimeters. 9.5 centimeters. Then occipitoposterior, typically there is a deflection, and occipitofrontal diameter, which is 11 centimeters, is the presenting part, and occiput is the presenting part. Bro, partial extension and mento-vertical, which is 13.5 centimeters, is the engaging diameter, and denominator is the frontum, and face presentation is the mentum, which is the presenting denominator. Engaging diameter is submento-bregmatic, which is 9.5 centimeters, and it is a complete extension. So this is one of the favorite questions of the examiner, doctor. They were very sure about it. The commonest cause of the breech presentation. Which one is it? Keep punching the answers, doctor. Let me check. How are you answering? Good to see Jitendra, Maruf Khan, Ben, and everyone. Inform your friends also that every day, not only a live class, we also have a Kahoot quiz. Kahoot is a platform which we use for conducting quiz, online quiz. You need to go to the URL kahoot.it and you need to choose a screen name and you need to play the quiz. Every question is 30 seconds. Time is being given to you. And you need to crack the question like, Kaun banega Kharodpati? Kaun banega PG Pati? If you crack 10 by 10 questions correctly, you need to take a screenshot of that and send to our helpline 9000868356. Immediately you will get the activation of the entire video library, mock tests, PowerPoints, notes, question bank, everything as a gift, which is otherwise worth of 40,000 rupees. And if you are able to crack 9 by 10 score, you get a 90% discount on that 40,000. If you score 8 by 10, you get 80% discount on that 40,000 worth of online mbbs.com, video library, mock tests, notes, and everything. So just drop a line to your friends to everyday come to YouTube and then play the Kahoot quiz and become topper and let us make learning free, learning affordable, right? So that is the whole idea. So the commonest cause of the breech, absolutely right, Ankur Sharma, prematurity. So about our earlier question, bro presentations, the common presenting reason is prematurity, multiple pregnancy, any goiter or hygroma. They are the presenting underlying etiological factors. Absolutely right, Jitendra. Once I start the quiz, I will give you the pin. So you need to enter the pin and then start playing the quiz. No worries, questions get broadcasted here. Answers are punched into through your mobile phone on the kahoot.it. Okay. So after we finish this discussion, we will start the quiz every day. And at one point of time, we plan to conduct 5 Kahoot quizzes, 9 a.m., 12 p.m., 3 p.m., and 6 p.m. and 9 p.m. We will start now. And if you all liked it, every day we will try to conduct 5 Kahoot quizzes and give over to the people who top 10 by 10 in Kahoot will get a free online mbbs.com subscription. Now, doctor, after coming head of the breech will have a difficulty in delivery. In which situation? Hydrocephalus, or if incomplete dilatation of cervix, or if there is an extension of head excessively, there are all the predisposing factors for the difficulty in delivery of a after coming breech. Now comes preterm delivery, which is that one measurement of fetal maturity that is not affected by a bloody tap when you are doing amniocentesis. Typically, phosphatidylglycerol glycerol levels are not affected by your bloody tap, whereas all other values, they get affected by a bloody tap. Nile blue sulfatase test. What does it basically test? It tests the lung maturity. So you should know shake test, tap test, Nile blue sulfate test. So more than 50% orange fetal squam cells is considered as an indicator of the fetal lung maturity in the Nile blue sulfate test is what you need to remember. Rahul Patwani is asking, sir, scholarship test when and where? Here only on the YouTube. After this obstetrics class is over, we will have a 10 MCQ quiz. Okay? You score 10 by 10, send the screenshot, and our helpline will send you free activation of the online mbbs.com video library, full-scale grant test. Everything will be offered free for you, right? That's good. Be ready with the teeth-to-teeth fight. Spardhaya Vardhate Vidya. Competition brings the shine to the knowledge. So, doctor, Rh immunization. What are the tests that differentiate between maternal and fetal blood cell? It is the apt test, which will differentiate. At 28-week gestation, amniocentesis shows a optical density 450 nanometers of 0.2, which is in the top of the third zone of the Lilly curve. What do you want to do? You need to repeat amniocentesis after 1 week. Shipra is asking, it will be tougher than PGI or AIMS? Oh, come on. It is more easier provided you are ready with the basics and you apply the common sense to the clinical scenarios. You will be able to crack. Rahul, just hold. Once we finish this obstetrics gynecology discussion, then I open up the quiz. The moment I open up the quiz, you will get the pin number displayed here that you can enter, and then we will play the game. Shortly, we are coming up with a mobile app of Incus, which is purely into quizzing. There will be 5 quiz tournaments across the day, and you can play and win the free mock tests and free online video library access worth of 40 to 50,000. I'm even talking to a lot of my other friends who are also into offering coaching. By you give, instead of cash, do Vidya made available to the deserving, meritorious guys, so that it helps in their branding. Maybe once we become popular in this quizzing of Kaun Banega PG Pati, right? Then that is the point where they will try to, many others will fall into that line. So, doctor, you should know about Lilly, don't be silly curve. So, doctor, there is a zone 3, which is on the top, zone 2, which is in the middle, zone 1 is a safe zone, which is lowest. So, if at all the optical density is falling in the zone 1, (346) answer is B, no sir. Okay, 346. No, clean Hoyer Betke test. Harsha, what is clean Hoyer Betke test? Once there is a feto-maternal transfusion, once the fetal cells and maternal cells mixed up, you are counting how much that mixing happened. for which the counting quantitatively, you do clean Hoyer bed K. Whereas apt test is more a qualitative test to differentiate whether it is a maternal or a fetal blood cell is what you need to remember. So coming back to the Lilly curve, typically zone 1, it indicates mild disease or no disease. In the zone 1, all the zone 1 is good zone, right? So zone 1 kids are followed with amniocentesis every 3 weeks. Now coming to the zone 2 may lower part of the zone 2 is more safer, upper part of the zone 2, middle part is unsafe. So low zone 2 are usually followed 1 to 2 weeks. Middle of the zone 2 require transfusion or delivery. And the patients in the zone 1 and low zone 2 can be allowed to proceed to term. And after they reach the term, then the labor is being induced. And in most cases, the middle of zone 2 will progress up to 36 to 38 weeks of gestation. So please remember all these numericals, doctor, which is the favorite MCQ of the examiner. Lastly, those women who are having extremely high titers, more than 256, at less than 28 weeks, if the fetus is not demonstrating any high drops, and typically there is a past history of fetal death due to high drops, such people should immediately be offered prophylactically intravenous immune serum globulin, IVIG. And what is the dose of IVIG, doctor? Last time we discussed 400 milligram per kg per day for 5 days with repeat infusions every 15 to 21 days. Now, what are the specific contraindications to the intravenous immunoglobulin? Intravenous immunoglobulin. Any previous episode of intravenous immunoglobulin induced anaphylaxis or any selective IgA deficiency is a specific contraindication. Now, this is one favorite slide you have to keep in your mind. Which antibodies are not associated with hemolytic disease of the newborn? So you should remember, Lewis lives. So Lewis, Lutheran, P, JKB, and Duffy, in the Duffy, FIB, they are not associated with hemolytic disease. Whereas the antibodies which are associated with the hemorrhagic disease are RH, Kelly kills, Duffy dies, Lewis lives, so Lewis is not associated. Duffy dies, Kelly kills, Lewis lives, so Lewis is not associated. Whereas Duffy, FIA, Kelly, Kid, there is JKA, they're all associated with the hemorrhagic, associated with incompatibility. At 28 weeks gestation, amniocentesis is showing, just now we discussed, at the top of the third zone of the Lilly curve. So the management is repeat amniocentesis after 1 week. Doctor, a 10-year-old girl, primary amenorrhea, malformed uterus, absent breast, classical of Turner syndrome, which is gonadal dysgenesis. Hypoplastic uterus, amenorrhea, absent breast, primary amenorrhea, Turner syndrome. Short stature, wide spaced nipples, amenorrhea, Turner, which is 45XO. To say discordance in the twins, what should be the difference in the two twins? It should be 25% with the larger twin as the index. Discrepancy should be 25%. Vaginal delivery can be permitted anywhere, but not in monochorionic, monoamniotic twins, is what you need to remember. Now, the risk of Asherman syndrome is highest in which situation? Especially for the postpartum hemorrhage where endometrium is all friable. If you try to do that grating, the chance of forming syncytia is very high, is what you need to remember. So how do you diagnose Asherman syndrome? We do hysteroscopy, saline sonography, hysterosalpingography. They're all the methods to identify Asherman. Acetic acid staining, acetoid appearance of the cervix is used for diagnosis of dysplasias, carcinoma in situ, squamous metaplasia, etc., etc. A 35-year-old T3 is observed to have CIN grade 3 on colonoscopy. What is the best treatment? So in our previous discussion, we have done a very detailed review on the same story. How do they approach pap smear, CIN1, CIN2, CIN3, conization, LEAP, etc., etc. So it is the LEAP which is the treatment. In a case of vesicular mole, what are the risk factors that it can go into choriocarcinoma? So you should know the list of risk factors. So the patient's age, if it is more than 40, less than 20, the chance of a molar pregnancy becoming choriocarcinoma is high. Parity more than 3, serum HCG more than 1 lakh, uterus size more than 20 weeks. Previous history of molar pregnancy, thecal lutein cysts large, which are more than 6 centimeters. They're all considered to be the risk factors of malignant change. A case of gestational trophoblastic disease is associated to have lung mets. What is the stage? Stage 3. Strictly confined to corpus, stage 1. Extending to adnex or vagina but limited to genital structures, 2. Extending to lungs, with or without genital involvement is 3. And 4 is all other metastatic sites. One of the favorite MCQ of the examiner. Savita is a 35-year-old female. Gravida 2, presenting with hepatic encephalopathy. This is a biscuit question. All of you know the answer. That is hepatitis E is what you need to remember. So the maternal mortality is highest with hepatitis E. Kamala is 48-year-old, underwent hysterectomy on the 7th day, after which urinary dibbling started. So hysterectomy in the background. Which kind of fistula is very common, doctor? Ureterovaginal fistula. Ureterovaginal fistula. Goniometer. Where do you use goniometer? So whenever there is any incontinence, the incontinence, especially stress incontinence, is due to the loss of uretrovesical angle. So to measure that, we use goniometer. Fallopian tube dysmotility is a feature of Carter-Jenner's syndrome. Impaired ciliary motility is a feature of Carter-Jenner. Now the various obstetric maneuvers. Doctor, I think you're all following. We are publishing 2-minute videos on this YouTube channel. Okay? Please share it, like it, download if required, no worries. But subscribe to this YouTube channel and make your friends also to subscribe. We are going to publish around 100,000 mnemonics, concepts, essential points, revision points for the exam in the form of 2-minute videos with a nice musical background. It's only 1 minute, 2 minutes, easy to remember. So let's make this viral videos. So please post them in Facebook, Twitter, LinkedIn, Telegram, WhatsApp, wherever you are there, and make them available to as many as possible. 2-minute videos on YouTube channel. Sudden hyperflexion of the thigh on the abdomen. It's called Mac-Roberts procedure. Which nerve is commonly damaged, vulnerable to damage in case of Mac-Roberts? Lateral cutaneous nerve of the thigh. So you know very well, the lady takes the thighs closer to the belly so that you are increasing the space for the exit of the baby. So there is a diagonal orientation of the symphysis making the shoulder to get delivered. Whereas whenever the pelvis tilts, symphysis is more horizontal and that facilitates the shoulder to deliver, which is called Mac-Roberts position, is what you need to remember. So what do you do for the management of shoulder dystocia? Mac-Roberts maneuver, suprapubic pressure, Wood's maneuver, they're all done for the delivery of the shoulder. So what is Wood corkscrews maneuver? The shoulders must be rotated, and for that you will be using the pressure overlying the scapula and the clavicle. You don't rotate the head, you will rotate the shoulder, right? Then the delivery is facilitated by counterclockwise rotation of the anterior shoulder or clockwise rotation of the posterior shoulder. So that is basically Wood's corkscrews maneuver, which is one of the important issue for examiners. So these various maneuvers, Morrishu simile-meet maneuver, Mac-Roberts maneuver, Wood's maneuver, all these maneuvers, like the chambers of Shaolin, you should be ready with all this karate and kung fu movements, right? Now, let's talk about pap smear. Pap smear helps with trichomonas, HPV, inflammatory changes. They all can be identified in the cytology done in the pap smear. Cervical smear fixation, how do you do? Ethyl alcohol. The commonest cause of the occipito-posterior OP position during the labor, it is the android pelvis is responsible. So what is the shortest diameter of the fetal head? It is the bitemporal diameter. Bitemporal is only 8.5 centimeters. Bitemporal is the shortest. During laparoscopy, what is the preferred site to obtain the culture if in case of PID? It is the salpingitis, which is commonly the initiating factor. That's the reason fallopian tubes. Now, danazole, we'll be using it in cyclical mastalgia. Typically, whenever there is any aberrations in normal development and involution of the breast. So all those things you have to be very sure how do you manage. The best agent for premenstrual syndrome, SSRIs. Now this is one of the favorite questions of the examiner, doctor. How do you manage? How do you manage premenstrual syndrome? Premenstrual syndrome. First line is always exercise, cognitive behavioral therapy, vitamin B6, combined new generation pill, either cyclically or continuously. Continuous or a luteal phase low dose SSRI like citalopram, escitalopram, 10 milligrams. Then what is second line? Estradiol patches plus micronized progesterone or levonorgestrel and higher doses of SSRIs. Then third line will be to treat the premenstrual syndrome. Very good to see Rituraj, most welcome. GnRH analogs, you add HRT plus progesterone. Then fourth line will be surgical treatment or hormone replacement therapy. So you should know these various levels of management of the premenstrual syndrome. Now comes puerperium. What is the correct order of lochia? Lochia rubra. Lochia rubra. Serosa alba. Rubra serosa alba. RSA is the order which you should not forget. A 26-year-old healthy female got pregnant first time. And LSCS was done for fetal distress. Mild hypertension was present during pregnancy. After delivery, she has headaches, seizures, but proteinuria is not there. So unlikely to be postpartum eclampsia. And the CT scan shows parasagittal hematoma, which is classical of sagittal sinus thrombosis. So pregnancy is a prothrombotic condition. So cerebral venous thrombosis. Cerebral venous thrombosis, one of the risk factors is pregnancy. Similarly, those women who are taking oral contraceptive pills with a severe headache, think of cerebral venous thrombosis. And the people who are less than 45 years and younger, who have very high estrogen, hyperestrogenic state itself is a prothrombotic state. So you pass a contrast and look for whether contrast is passing through and through. And a decreased passage of the contrast on one side, whereas a good passage on the other side is an important clue of the presence of the thrombus, is what you need to remember. At what gestational age surfactant appears? 28 weeks is the time where surfactant appears. Breathing in utero. It causes condition of the respiratory muscles. It increases the risk of amniotic fluid aspiration. But breathing rate up to first 100 days it is high. Slowly it will slow down and reach 30 per minute by the time it is 140 days. That's what you need to remember. So which sterilization has maximum chance of reversal, doctor? Laparoscopic tubal ligation with clips. Apply clip, remove clip is easier, so reversibility is high. Most common site of ligation कहाँ करते हैं? Isthmus. The most common cause of vesico-vaginal fistula in India is obstructed labor. Obstructed labor. A lady underwent vaginal hysterectomy for CA cervix. After the surgery, her urethral catheter was removed and she is having urinary incontinence. You have passed the diphenylphenazopyridine, and when you checked the pad, there is a yellow staining at the top portion, but not in the middle or bottom. So what is the likely possibility? Ureter banta hai bladder, bladder banta hai urethra. Ureter become bladder, bladder become urethra. So who is communicating with vagina is important. So ureter, if it communicates, uppermost become stained. When the bladder communicates, that is called vesico-vaginal, middle. Or it can be urethro-vaginal, which is lower. So topmost or middle swab is vesico-vaginal. Uppermost swab wetting but not discoloration is uretero-vaginal. And discoloration of the lowermost swab but upper two swabs remain dry means urethro-vaginal. We have discussed it at great detail in the online mbbs.com video library. The most common site for the primary for intraocular metastasis, they all go to breast. It is the breast that goes to the eye, intraocular metastasis. What is the risk of complex hyperplasia with a type A becoming malignant endometrial carcinoma? 28%. Simple cystic without a type A, there is a 1% chance. Complex 3%. Simple atypical 8%. Complex atypical 29% is what you need to remember. So what is the best parameter? We are almost reaching the last 10 questions. Thank you all for giving a wonderful company last entire 1 month of June. We have spent all our energy, time in doing the revision of the so-called huge mountain called like Meru Parvat, obstetrics and gynecology. We discussed so many concepts, so many critical questions, etc. You all made very good notes, and all these PPTs, everything are already available in the onlinemmbbs.com. So please do join. Now, should your answers, doctor? Sai Subramaniam is saying femur length. Excellent. So, short femurs may be a normal finding or a marker of aneuploidy. Trisomy 21. Severely shortened femur length means you should think of skeletal dysplasia or a early onset IUGR is what you need to remember. Now, these are all the risk factors for the post-operative infection once you do hysterectomy. If you have done hysterectomy to treat malignancy, or you have done urinary catheterization more than 7 days, or if you use a transfusion, they're all considered to be the risk factors. Anyway, hysterectomy you'll do after 50 only now. Hysteroscopy, we use it for all of this: abdominal vaginal bleeding, infertility, recurrent stillbirths, or uterine synechia. The birth weight of a baby, smoking is an important risk for a low birth weight baby. So it can be increased by stopping the smoking. Acetylcholinesterase levels are an important indicator of the neural tube defects. Chorioamnionitis, preterm labor, endometritis, abruptio, they all increase the risk of a premature rupture leading to chorioamnionitis. Women who has post-dated pregnancy, what is the most important thing you need to reassure? You have to properly review her previous menstrual history. Paradoxical thing is, a good number of times patient forgets, patient's husband remembers the last menstrual period. Or her very enthusiastic mother-in-law, she is counting days. When will my daughter-in-law become pregnant? And she remembers LMP a good number of times. So that is the reason often one of the most important reasons for a wrong dating of pregnancy is a wrong last menstrual period history is what you need to remember. A 30-year-old female from poor socio-economic strata from a hill station presents with frequency, dysuria, hematuria, loss of appetite, mild fever and amenorrhea. So the most likely cause for her complaints would be हम इस देश के वासी हैं जिस देश में टीबी बहती है. Jai Hind sir, says Lavkush Thakur. Very good. Next subject will be surgery from tomorrow. Right? Oh, tomorrow is it Sunday or Saturday? What is tomorrow? Tomorrow is Sunday, right? Very good, very good. So doctor, don't forget, every Sunday we have a full-scale grand test. Ta-ta-ta! NEET PG full-scale mock test. So by now they might have hosted the next online test. Please take the test. Afternoon 2 o'clock, be ready with Dr. Murli Bharadwaj. You are going to have the revision of full-scale NEET PG grand test every Sunday, right? So, and from Monday, freshly let us start surgery. And there are almost 1,000 questions even in surgery. We will try to finish within 2 to 3 weeks. Most of the concepts in the subject of surgery by revising last 15 years of All India and AIMS, All India and NEET PG and AIMS question bank of surgery topic wise. Also bring your friends. Every day we will play a Kahoot quiz, and if you are able to crack 10 by 10 jackpot, you get that free admission into 40,000 rupees worth of online mbbs.com, video library, full-scale grand test, notes, 30,000 Q scanner, everything will give an instant activation. After winning the quiz, you need to send a screenshot. You can even play for your friend also. Even if you win also, we'll give it to your friend. No worries. Now, doctor, that brings us to the end of the today's our long journey. So, doctor, are you ready? Yes, sir. Do you want to crack a great quiz? Yay. Yes, doctor. No. Yes. So, okay, doctor, all of you need to go to, yeah. Yeah. So please go to kahoot.it. One minute, doctor. Let me. Yes. Very good. Now all of you are able to see. You need to go to kahoot.it. Kahoot.it. Very good. Sveta is in game. Lawrence is in game. Shipra is in game. Ben is in game. Very easy. You need to go to kahoot.it and enter this. Enter this. So today, whoever is going to win is going to get 40,000 rupees worth of online MBBS.com video library, full-scale mock tests, MCQs, everything free. Immediately activated as a compliment. If you score 10 by 10, that is important. No worries, even if you score 9 by 10 also, still you get 90% discount. 8 by 10 you get 80% discount. 7 by 10 you get 70% discount. But be ready with the 10 questions. Be ready with the 10 questions. So we have 10 players. You need to look for the questions here and then you need to go to the answers there. You need to punch answers on kahoot.it. Are we expecting some more? We already have 10 players in the game. So we have 10 MCQs and 10 players. Shuru kare? That's right. Let's make the start. A 35-year-old man with a history of recent head trauma develops tonic-clonic seizures. He develops tonic-clonic seizures. He started on phenytoin therapy. You have only 30 seconds time. He develops fever, erythematous skin eruption, and he comes to your clinic. He's febrile. He is unremarkable, except for a diffuse axillary and inguinal lymphadenopathy. Very good. Only one person could make it right. Right? Only one person could be able to make it right. Okay, that's good. That's good. So only one person is able to make it right. And that person is Ujala. Ujala, no, 001 is able to make it. Very good, very good. Now, doctor, the next question. The answer is phenytoin associated hypersensitivity reaction. A 24-year-old man, Coca-Cola colored urine. This is the first episode. Yesterday he had upper respiratory symptoms. Very good. Two of you have correctly answered. It is a case of IgA nephropathy leading to recurrent benign hematuria is what you need to remember. So, very good. So, Ben is the one who answered it fastest than anybody else. This question. Very good. Next. Get ready. A 73-year-old woman from Jaipur presents with watery stools every 2 to 3 hours. Every 2 to 3 hours. For the past 4 days, her prior medical history includes hypertension, coronary artery disease, and her creatinine 2.1, bicarbonate 17, and her blood pressure is 116/78. Very good. 3 of you are able to crack it correctly. Excellent, doctor. Excellent. And who is that? Ujala is on the top of the race by being fastest in answering this particular question, followed by Shweta. Very good. Very good, doctor. Now get ready for the next question. 4 out of 10. Kaun banega PG Pati? What is the skin disorder which is pathognomonic? Remember, pathognomonic of AIDS is a very, very, very important question. Come on, who is ready to give me the correct answer? 7 answers. Excellent. Punch, punch, boom, 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 boom. What is your answer? Excellent. Only one is able to answer it correctly. That is 001 once more comes to the top. Being the right guy, it is bacillary angiomatosis, which is the pathognomonic feature. Now, which disease in the patient population or a patient population is associated with spontaneous pneumothorax? Spontaneous pneumothorax. Come on, doctor. You have 30 seconds time. Very good, very good, very good. Excellent. Only 2 of you have done correct. Lymphangioliomyomatosis is associated with spontaneous pneumothorax. And that brings Ujala to the top of the game. Very good, Doc. Very good. Now, the question number 6. Before you become Kaun Banega Karodpati for the NEET PG exam, a 62-year-old woman complains of shortness of breath. She has past history of hypertension, was on hydrochlorothiazide. She is also having depression. She doesn't smoke. She doesn't drink. When you examine, find late inspiratory crackles in the upper lobes. Prominent interstitial markings. Oh, nobody could be able to pick up that it is berylliosis. Berylliosis. No, doctor. A good number of you thought it as sarcoidosis. I know that is the most common wrong answer. No worries. Now, doctor, 7 by 10. How many of you are ready? Spardhaya vardhate vidya. Which is considered a major diagnostic zones criteria of rheumatic fever. Major criteria. Which one it is? Come on, punch. Punch your answer. Very good, doctor. Very good. Excellent. Korea. 5 out of you have correctly answered. I am very proud of you. But the most commonly wrongly thought answer is fever. No. Next. So that brings once more Ujala onto the top. 8 by 10. Be very sure. 68-year-old woman presents with complaints of dysphagia for the past 18 months. She notes difficulty in swallowing of liquids and solids. That is not progressive in nature. She feels that something, food and liquid, is getting stuck. She notes a weight loss of approximately 2 kgs in the past year. She has no tobacco or alcohol abuse. Oh, you might have diagnosed this as a case of achalasia and might have answered it as manometry. But most of you thought to do 24-hour pH recording. No, manometry is the one that is the next important step. Now, doctor, 9 by 10. 9 by 10. Who is going to give me the correct answer? Oh, this is a little long story. A 27-year-old from Mumbai, sweaty skin, hyperthyroid features, and bilateral lid lag. So, RAIU, radioactive iodine uptake and thyroid scintigraphy. In the case of the Graves' disease, what do you expect? Only one is able to correctly answer. High uptake and homogeneous uptake. High uptake of RAIU and a homogeneous uptake is the classical feature of Graves' disease. And that keeps Ujala still on the top, but Bem is the one who has cracked this question, I believe. The last question for the today's Kaun Banega PG Pati. A 64-year-old man presents with a skin rash, which is erythematous, annular, not easily broken. There is a sparse perivascular leukocytic infiltrate with some eosinophils. And immunofluorescence shows linear deposits of IgG and C3 in the epidermal basement. Very good. Excellent, doctor, excellent. 5 out of you have correctly answered. And let us see, doc. Yay! Shipra on the 3rd position. 001 in the 2nd position. And the hero of the day is Ujala. So, Ujala answered 4 out of 10 only. And 001 answered 4 out of 10. But I want 10 by 10 for you to win a free online MBBS video library. So doctor, tell your friends also to join, and take a screenshot and send Ujala. You will get 40% discount. If you want to still try some more games before you get 10 by 10, that's altogether great. So thank you very much for all of you for joining this wonderful quiz. Please WhatsApp your feedback, how you felt about the quiz, and shall we play more number of quizzes every day so that you are on the edge of the game, right? So thank you very much.